those who can afford medical internship will be the ones.
For a considerable period, intern doctors have been on strike, citing the government's failure to deploy them.
That policy is not acceptable.
The atmosphere has been tense as this issue had persisted.
To avoid further loss of time, Dr. Twin added that they will be reimbursed if the Ministry of Finance avails funds.
However, there is now a glimmer of hope as the government has finally agreed to deploy 1,901 medical interns across 53 centers nationwide. This decision has been met with happiness and relief among many.
To thank the Ministry of Health for coming out and finally guiding on the issue of medical internship.
The Deputy Secretary General of the Uganda Medical Association, Dr. Faith Nabushawo, expressed satisfaction with this development.
We really thank the Ministry of Health for that.
Yet amidst the positive news, Dr. Nabushawo also raised a concern regarding the decision to offer 1 million shillings to interns.
I'll give an instance, an intern in Kawempe Hospital. They are not given accommodation by the hospitals, and now with that little pay, the intern has to pay rent, has to get food and transport, daily transport to and from work. So we were interns laid down tools, decrying poor pay, and now from what the Ministry of Health communicated in their letter, I see that we are going back to where we came from.
She stated that this financial offer is not welcomed by the Medical Association.
Look at our neighbors, Kenya, for example. It is deploying twice the number of interns we have here, and they are being deployed with better pay. I think that our government, either our government isn't just prioritizing these health professionals, but it's high time government came up with good, long-lasting solutions.
Dr. Nabushawo, who once served as the chairperson of the Federation of Intern Doctors, sees this decision as a betrayal of the commitment made in 2021.
See that we are going back to where we came from. We are going to end up moving in circles. Interns striked because of poor pay, and now 2 years down the road, after you've increased it slightly, you're now going back to where you came from. I don't think that that is a wise decision, because these current interns still will be excited because, yeah, they have finally been deployed. But at the end of the day, they are going to be distressed with little pay.
Despite the discontent over the monetary package, the Uganda Medical Association is urging all interns to report for work.
They accept and report to the sites and continue pushing government to go back to the initial, the agreed 2.5 pay. Yeah, we are not going to, even under Uganda Medical Association, we are not stopping. We are continuing with the talks with the Ministry of Health and government to have these interns better paid, because it's very important.
Interns are expected to commence their duties on 3rd of August 2023, as stated in the ministry's memo. Robert Anyango, UBC News.